In hospitals and health centres around the country, a push is being made to standardise and improve the quality of services for expecting mothers and babies. Called the Mother Safe Hospital Initiative, the program is a set of 12 agreed-upon guidelines that include such areas as a safe motherhood hospital policy, training, equipment, educational material for clients, standard antenatal care, delivery care, postpartum care for mothers, data collection, and internal and external audit processes to monitor, supervise, and evaluate adherence to the MSHI standards. Of all the 12 components of the MSHI initiative, staff education, documentation, and the ongoing internal and external audit processes have resulted in measurable improvements to the services provided to mothers and babies, because progress can be tracked and gaps in the health services quickly identified and addressed.
One of the training that we go along with at the moment is MNOC. And this is one of the training, I think, with the FHSSP for always sponsoring this. And at the moment, I think all those staffs who have been here for the past year, they have all gone through MNOC. Also, when we have the training, we make sure when they come back to the ward, we see that it's implemented. And only when they do this kind of training that they're able to go on when there's emergency, they come in and attend. Because what I've seen is that when new people come in and when they get their training, when there's emergency, they are not able to cope.
All the care that you have done, that you had delivered to the patient, it's supposed to be documented. In case that something happens to the patient, that will safeguard us.
A highlight has been the Nandi Subdivisional Hospital, which has improved from 50% in the fourth quarter of 2014 to 84% adherence in June 2015, which means a fully functioning rating for 10 out of the 12 MSHI standards.
In Nandi Hospital, we had a lot of complaints, customer complaints. What we have seen now is we might just receive 1 or 2 per month now. What we used to receive before was like about 10 to 15. We couldn't go back and see what services were provided, not because it wasn't documented. Now, when things are documented, it's easier for us. If there is a complaint, we can always refer back and see what happened. Did the nurse really do that, provide that service and it is documented, or is it just the patient is complaining about it, or where the downfall was? And as you know, for us nurses, if you don't document something, that means you haven't done it.
Since the initial audit in 2013, the Australian government-funded Fiji Health Sector Support Program has used the gaps that were identified to provide targeted assistance to selected hospitals to help them improve adherence.
When the help comes in, even for me, sometimes I'm frustrated, but when the help comes in, I know that there are people out there who are willing to give in for this kind of, and this is one thing that boosts the morale that's here in the world, especially after our mothers.
When the feedback was given to us from the audit teams, the external audit teams, it really boosted their morale. They're really into it, doing things according to the standard that is required.